Hey guys, how are you doing out there? My name is Matthew St. Amy. I'm a licensed physical therapist and doctor of physical therapy. I had some thoughts today, something I want to share with everyone, but also, see what feedback I can get from my colleagues out there. I've been in the field for quite a while now, for a little bit over 20 years, dating myself a little bit. At the time when I came out, the bachelor's and master's were the two main programs for physical therapy. DPT was being offered by a few schools out there, but it wasn't that popular and not that well known about. Everybody was talking after I graduated that the DPT would eventually become the main degree. The idea was by 2020, that was the goal of the APTA, was to get our profession moved towards the DPT. Now, as you see, the curriculums for all the schools have been transitioned over to DPT, and there's no schools that I know about that aren't. And the big thing is, what is the purpose of the DPT? A lot of my colleagues who graduated before the DPT became the main degree, or when other degrees were being offered, they felt there was no need to go back and get their DPT. They didn't see the value of it, and they didn't understand the purpose and logic of increasing curriculum expenditure and requiring many physical therapists getting into the programs to have to go through a DPT, a doctorate level of education for our profession. The main thing they questioned was, what is the plan and what does the DPT offer curriculum-wise more than what their degrees did when they went through school? So, I question it somewhat as well. I know that there is a higher level of requirements to get into the program for a DPT, and I also know that the research requiring further research paper documentation to achieve your degree is at a higher level. However, there were high standards placed on our bachelor's and master's degrees when I first graduated. And the things we have to do, some of it is not even being done today. We had to do gross anatomy, and every program had some form of gross anatomy. I mean, maybe some of them didn't, but many did. My program did. And I know many of the programs today don't offer gross anatomy. And also, we had to do projects that involved creating our own practice, our own physical therapy practice from the ground up. I was 1 year in my program behind the last project that was required for graduation, but I did get exposed to what they had to do, and we did have a lot of that in our curriculum in regards to being educated and informed about being a private practitioner. So today, I know there's a lot of push towards people becoming cash-based practice, also getting the direct access, which is what I'm very, 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 very strongly pushing towards. I want us to have a level of autonomy and also be practitioners of record. The amount of education we do for doctorates now, I think, is definitely on par with advanced nurse practitioner. And now they have doctorate level nurse practitioners. We are on par with that. We have the curriculum in our degree set, in our curriculum, that keeps our minds at a level of being able to function equivalent to what they do. And in our area of expertise, which is movement science, we have the capacity to do far more than they do and than they ever learn in their curriculum. They can beat us in the pharmaceutical part because they focus a lot on trying to, I want to be gentle with the way I word things, but they do follow the medical model a little bit in regards to pushing the medication track. I know we learn about it, but we don't emphasize it as part of what we do clinically, because we just need to know what is being offered by these patients through medical management and how it can interfere with what we do. But from a standpoint of clinical assessment, hands-on assessment, we are on a par with any medical physician out there when it comes to putting our hands on a patient and feeling what's going on in them. And yet, we are not given the level of respect and recognition for our capacity to touch patients and assess what's going on and be responsible in the way we treat them, even with a doctorate degree. So my colleagues that have asked in the past, why do we need this doctorate? I still question that. I question it. I went and got my doctorate, and I question still, even with the knowledge I obtained from it, it was extra things that I did obtain at the time with manual therapy skills, but that stuff could have been done through certification courses and programs. I didn't need to get my doctorate to do that. Diagnostic stuff also could be done through certification programs, continuing education. So there was nothing, like I say, that was specifically unique that if I didn't go to that doctorate program, that I couldn't obtain outside of that without getting that extra degree.